My name's Benedict Leonard. I'm a white settler of Irish and English ancestry. Today I'm discussing my practicum work with Island Health's cultural safety program called Dismantling the Status Quo, Indigenous-Specific Anti-Racism Learning Journeys. This learning journey consists of monthly commitments from the entire Island Health leadership cohort on Kwakwaka'wakw territory, otherwise known as the North Vancouver Island Health Region, and will become an ongoing exercise in self-reflective anti-racism practice. This public health intervention is in response to the overwhelming evidence demonstrating how Indigenous-specific racism prevents access to healthcare services for Indigenous people. This presentation covers Indigenous-specific racism and the public health intervention introducing Indigenous-specific anti-racism within Island Health. I'll discuss how my own learning journey is interwoven throughout this work. Using an anti-racism and decolonial approach, these learning journeys contribute to an interpersonal, structural, and organizational approach to dismantling systemic racism within Island Health. This work would not be possible without the guidance, support, and leadership from Kathleen Harris and Dean Wilson. They're among the many Indigenous people whose time and patience helped to shape my learning. I'm a white settler living on the stolen and traditional lands of the Lekwungen peoples and home to the Songhees and Esquimalt First Nations. Most of my learning journey has taken place on the territories of the Nuu-chah-nulth and Kwakwaka'wakw First Nations. I recognize the unearned privilege that enables me to move between these lands and always find a comfortable home. Learning what this means to me has been a journey of self-discovery, humility, and unlearning so much of what I thought I knew and how I knew it. This unlearning has also taught me how I'm responsible for dismantling the systems of unfair advantage that continue to oppress so many. And so I invite you to join me along my learning journey. Indigenous-specific racism is well documented through over 100 years of commissions and government reports. In fact, the Canadian government started receiving reports of the systemic and racist abuse being committed in residential schools as early as 1904 by the Chief Medical Officer for the Department of Indian Affairs, Dr. Peter Henderson Bryce. Most recently, the In Plain Sight report captured the voices and testimonies of thousands of Indigenous people in the province of BC. This report built upon the Indigenous knowledge and evidence from the Truth and Reconciliation Commission and the National Inquiry into Missing and Murdered Indigenous Women and Girls. After the release of In Plain Sight, I began hearing whispers in Island Health as people started to use the word racism in its hallways. I've worked for the last 5 years as an Indigenous liaison nurse within Island Health, and every day I would listen to stories of racism, discrimination, and systemic barriers to accessing healthcare by Indigenous patients. This was in fact the defining moment when I decided to pursue a master's degree focused on health system change and Indigenous-specific anti-racism. Some definitions that guide this work. Decolonization is the intelligent, calculated, and active resistance to forces of colonialism that perpetuate the subjugation of our minds, bodies, and lands, and it is engaged for the ultimate purpose of overturning the colonial structure and realizing Indigenous liberation. Anti-racism is more than just not being racist. It involves taking action to create conditions of greater inclusion, equality, and justice. It's the practice of actively identifying, challenging, preventing, and eliminating racist ideologies and changing the values, structures, policies, programs, practices, and behaviors that perpetuate racism. Two-Eyed Seeing is an Indigenous framework introduced by Mi'kmaq elders Merdina and Albert Marshall. Two-Eyed Seeing positions Indigenous and Western knowledge and worldviews on equal footing. Elder Albert Marshall says that we need to honestly be able to say that the essence, the spirit of our two ways has been respected as we work to balance the energies of those ways. So Island Health has committed to cultural safety and anti-racism learning journeys in a joint project in 2020 called Paddling Together. Island Health and the First Nations Health Authority co-created a plan to improve the experience of cultural safety. In response to recommendations given by elders, Island Health commits to support leadership and staff to advance their cultural safety learning journey and support the creation of processes that create accountability around racism, including the participation in communities of practice and other advanced cultural safety learning opportunities. So the antidote for Indigenous-specific racism is Indigenous-specific anti-racism. This is called for in the Truth and Reconciliation Calls to Action, the National Inquiry into Missing and Murdered Indigenous Women and Girls, and repeatedly referred to in the In Plain Sight report. Also, the recent HSO British Columbia Cultural Safety and Humility Standard mentions anti-racism over 100 times, beginning with standard 1.1, that the organizational leaders are accountable for the organization's commitment to anti-racism and cultural safety and humility. These standards speak to three interconnected levels of change at the structural, organizational, and interpersonal levels, as introduced by our guest speaker, Senator Greenwood. The Indigenous-specific anti-racism learning journey being implemented on Kwakwaka'wakw territory addresses each of these levels. The structural by introducing a model where medical directors join team leaders on an educational journey. Organizational by increasing awareness and capacity of Indigenous-specific anti-racism within leadership roles. And interpersonal change by implementing a reflective process for leaders to co-create anti-racism and cultural safety throughout their teams. So we're using learning journeys as the model for this work. This includes Indigenous ways of knowing and relationships in collaboration with Western scholarly and evidence-based sources. An Indigenous and non-Indigenous co-facilitator co-create a two-eyed seeing approach to support these learning journeys. The cohort is the entire Island Health leadership team on Kwakwaka'wakw territory who self-identified as needing Indigenous-specific anti-racism education. And I'll leave you with a quote by Australian Indigenous academic and artist Lilla Watson, who said, "If you're here to help me, you're wasting your time. But if you have come because your liberation is bound up in mine, then let us work together." Thank you.